Today we're going to talk about colon cancer, or what we call colorectal carcinoma or colorectal cancer. You can even call it colon carcinoma. Now, this is the cancer that usually affect the large intestines, what we call colon, and also the rectum. These are the extreme ends of the intestines, now almost near the anus. So we are going to focus on that. Now, the reason we are going to focus on this is because it's one of the leading causes of deaths which are related to cancer. And this is mostly because we don't get to know the earliest possible that you have this. So if you can be able to detect early that you have this cancer, prognosis is so positive, goes all the way up to 90%, as it happens to most of the cancer cases. So if we can be able, and by the way, this is one of the tricky ones because sometimes the signs can overlap with other signs, so it's very easy to ignore. So we're going to look at the stages, the risk factors, the signs and the symptoms, what you can look, and this is the reason why I'm making this video. It's very important for you to know the signs and the symptoms so that in case you find any of them, you can be able to go get screened so that it can be detected early enough. And like we said, 90% of the detected cases, if it was detected early enough, 90% usually give a very positive prognosis, which is the positive progression of the disease. So you are able to treat it completely and improve the quality of life. We're also going to look at the possible treatments and prevention. So this is a packed video, and this is that point where I usually tell you that in case you're gaining value from this channel, I would want you to subscribe and also hit the notification bell so that you get to be notified every time I upload something as interesting as this. And also make sure you share to the friends, because now sharing this information means that we are spreading the cancer awareness and you can be able to pick this early enough. Like we said, we really need to pick cancer very early, like you're going to see it alone. Now, most colorectal cancer usually begin as a small precancerous polyps in a part of the digestive system, in the intestines, both large and small, also in the rectum. So it's a growth that usually starts very small and grows over time to become something that's very troublesome and big. And like you're going to see in some of the symptoms, it can lead to obstructions and some other symptoms which are very nasty, and it usually reduces the quality of life. So you're going to look at that. So if you look at the gastrointestinal system, which is the pipe running from the mouth all the way to the anal opening, we have the mouth, and then we have the esophagus, which is what now leads to the stomach. From the stomach, you go to the upper part of the small intestines, what we call duodenum, and from there you go to now the small intestines. Now, this small intestines usually meander along and is surrounded by the large intestines, and this is what we are calling the colon. And now the colon usually ends into the rectum, and this acts as a temporary storage for the fecal matter. And after the opening, when you go to empty your bowel, it opens the sphincter muscles, and this is now it comes out through the anal opening. Now, the small intestines, we are not going to focus on that today. We are going to focus on the large intestines. And back to the colon, where the small intestines ends, that's where the large intestines usually start, and we have the ascending colon, and then we have the transverse colon that usually go across, and then we have the descending colon, and then we have the sigmoid colon that usually connect to the rectum and anus. And we shall concentrate on the colon, like I said, and the rectum, because this is the area where we are going to have the polyps that usually graduate to cancer. So we're going to look more into this. I'm going to divide colon into two, the right and the left side, and you're going to see the importance of this later on when it comes to cancer progression and also detection, because depending on where the symptoms are or where the tumor or the growth is, whether right or left sides, is going to affect whether you're going to find the symptoms or get the symptoms and how the general appearance will be. So it's very important for you to know that you're going to have two sides and you're going to see the reasons why. Now, what's cancer in the first place? Now, do you know that since you are born, your cells usually grow and they divide and create new cells, either to make a replacement of a cell which died or to enlarge you, to make you bigger. So you grow by increasing the number of cells that you have. And also the bones, that's something else. We're going to concentrate on the cells. Now, when it comes to cell division and growth and multiplication of the cells, this is a process which is highly regulated. We have oncogenes which usually control how many cells you can get over a certain period of time. And this is very important because this is where now the cancer goes. If the cells cannot be able to be controlled, they usually overgrow. So they grow, they create a tumor, a huge one, depending on the location and the type of cancer that you have. So they overgrow, creating a very huge tumor. So this tumor is what we are now calling the cancer. So a cancerous tumor is a tumor which has so many cells that are dividing actively. And we have several stages. We have stage 1. Now we are narrowing down to the colorectal cancer. Now this is also known as carcinoma in situ. And at this point, the cancer is in very early stages and it has not grown further other than just the inner layer of the colon, and will usually be easy to treat. So this one, once you detect during the stage, you just remove it. It's very easy to remove and also to treat at this stage. Now in stage 1, the cancer has grown into the next layer of the tissue. Take for example, the mucosa. So if it was in the mucosa, it's now growing into the next layer. So this is stage 1. Now let's go to stage 2. Now in stage 2, the cancer has grown throughout the layers. We have mucosa and all the other layers, and it has emerged on the outer side. So the whole of the wall is affected by this cancer. This is stage 2. Now in stage 3, the cancer has grown through the outer layers of the colon and reached the 3 lymph nodes. We have lymphs that usually surround most of the areas that we have. We have the ones that are between the legs, we have others here, we have others here, we have others that are around the intestine. So it has reached even the lymph nodes. So this is now stage 3, and it has not spread at this point. It's still in one place. So it has not gone to now stage 4, which is where now, in addition to now stage 3, now it's spreading to other organs. So you can find it in other areas like in the lungs, you can find it in the liver and other organs of the body. So this is what we call metastasis. This is the movement of the cancer to other areas. Now, what are the things that can make you get this type of cancer? Now we are talking about the risks, the things which can predispose you to getting this cancer. One is age. The older you get, your immune cells becomes, or your immune response becomes a little bit weaker, and immunity is very important to come to controlling the growth of your cells. Any rogue cell is usually killed by your immune cells, and the normal cells are usually left intact. So your immunity plays a major role. Now, even the mechanisms that usually control the growth of the cells usually wear out, so it predisposes you to the overgrowth and getting the tumor. So you are at a higher risk of getting this if you get older, the older you get. We have other conditions which can predispose you to getting this cancer, like inflammatory bowel disease, such like Crohn's disease, and also we have chronic ulcerative colitis. Now, people with many polyps tend to be inherited. So you can find this in a family, meaning that it's inherited down the generations. If you have that tendency of getting the polyps, if they are adenomas or serrated polyps or any other type of a polyp, they tend to predispose you to getting this. And like I said, this can be genetical. So this can be passed down. So it can bring a genetical predisposition of getting those. Now, we have, now when it comes to lifestyle, we have low fiber foods and also high fat diets. They predisposes you to this. Now, you have another one, which is a little bit more interesting, a high sugar intake. High sugar intake predisposes you to so many things. But there is one thing that you need to understand. Sugars usually don't cause cancer. It usually makes cancer more aggressive because cancer cells are usually very, let's say, power hungry. So they require a lot of resources, one of which is glucose. And this glucose, if you provide excess of this, so they are going to be even happier because now they can be able to use the resources available. So sugar will make cancer worse, but it doesn't actually cause. But you need to avoid processed sugar because of the reasons that I've given in so many videos that I've made in the past. So you can just go and check. Now, we have another thing, highly processed meats and meat products, especially red meat. There is a high correlation. We have so many studies proving that increased intake of processed meats usually predisposes you to this. And also lack of exercises and a gain in weight. If you gain a lot of weight, you're predisposing yourself to this. Exercises are usually very universal. If you exercise more, you become more healthier. And this includes the cancer that you're talking about here. You will reduce the risk of getting this. Now, we have recreational drugs like over intake of alcohol, we have tobacco, smoking. If you take them in excess, if you can stop, the better. If you cannot, reduce them to minimal limits. If you can be able to survive without that, then the better. Just stay away from them. Now, we have radiation therapy. In case maybe you had another cancer, and one of the areas that was being targeted was close to the colon, the intestines, it can predispose you to getting the cancer because this is radiation. And radiation, we have ionizing radiation, which can cause some other not so much desired effects. So one of the effects is that radiation can be you're treating another cancer, and it can also predispose you to another cancer. Now, still on radiation, we have imaging techniques that usually use radiation to create that image. If you predispose yourself, or if you have several of those, or maybe you have an increased exposure to the same, this can lead you to getting the cancer. Now, let's go to a very important part of this video, the signs and symptoms. One thing you have to understand is this cancer can be asymptomatic, and this is the reason why we usually have so many cases when it comes to this, so many deaths that usually come from colon cancer. The reason this is because sometimes it's on a particular side of the colon. Like we said, we have the right and the left. So it can be asymptomatic for a long time, to a point where by the time you're discovering that you have that, it's already too late. It's in stage 4, maybe even metastasis is starting to happen. Now let's go to the signs and symptoms. Now, first one, you observe the stool. You start getting narrow stool, very narrow. Okay, it can change depending on the size of the tumor and the shape also. We usually call it pencil shape. So this is a tumor which is obstructing the passage. We call that the pipe. Inside the pipe, we call that lumen. So if you have a tumor inside, so it's kind of obstructing the passage. So the stool will have to be forced through the narrow passage, which is left on maybe a very tiny or a little bit larger. But once it starts progressing, it becomes even narrower, narrower, and narrower, meaning that at the end of the day, you're going to use a lot of force to force that stool outside. So that's how you're going to get very narrow stool. So this is one of them, and you use a lot of effort to push it out. Now, you might have a frequent visit to the bathroom and passing very little or no stool. So you feel that you need to go to the washroom, but when you go there, you just pass a very small amount, and depending on the urge that you had, it's not proportional. And also the size, or maybe sometimes you're not even getting any. So you go to the washroom and you don't get that stool. Now, you might have a feeling that you still have the stool left, even after passing the small amount that we are talking about here. You still have that feeling that you did not fully empty the bowel. This is because of the tumor. No, this tumor is kind of enforcing or putting pressure, and this is some of the things that will be registered by your brains, and it will detect or feel that you still have something left. So this is why you're going to feel that feeling that the bile, you still have something inside. And also pain when you're passing out urine, or you just get that discomfort because now you're forcing. If the tumor is so big, you are using a lot of effort to push it through. So this is how it's going to be. Also, this tumor is pressing on other organs around the colon, and this can also provide or give you some very bad discomforts that's not actually going away. Sometimes it can be worse when the stool is passing through, and this is the point where I talked about the right hand side and also the left hand side. So the right side is less noticeable because the stool is still soft. Remember, stool is coming directly from the small intestines and getting into the colon. In the colon, this is where most of the water from the stool is taken out. So as the stool progresses all the way toward the anus, this is where a lot of water is usually kind of pulled out. So it's pumped out, kind of sucked out. And this is how now the stool becomes hard. So it's less noticeable on the right side because the stool is still soft. Now, when it comes to the left side, by the time it's getting to this point, a lot of water has been pulled out, so it's harder. So if you have a tumor here, you're going to get pressure the obstruction will be there because now the stool is solid. It can be able to exert pressure on the tumor, so you're going to feel the signs and symptoms, and this is the reason you are going to feel that feeling of you still have something left even after emptying your bowel. So this is mostly where you get the signs and the symptoms. But when it comes to the right side, Mostly because the stool is still soft, it's very easy to miss a diagnosis here, and you discover when it's already too late. And when you're getting obstruction, it comes to the right side, it's because the tumor is so huge, it's even closing the channel or the lumen where now everything is supposed to pass through. Another sign is constipation. Remember, we have a tumor that's closing or obstructing the path, meaning even the bowel movement is affected. And if the stool takes longer in the intestines, more of the water will be pulled out, making it even more harder. So the delay in passing of this stool will create what we call constipation, because now the stool will be so hard, and even passing it will be a little bit harder. Maybe sometimes you can even require assistance, something like laxatives or maybe physical removal. Another sign is bowel incontinence, and this is whereby the stool, you are not able to stop it. So it just passes out. Mostly, this is due to rectal and anal muscle, which are affected by the tumor. If they are affected, the brakes will not work, so you are not able to stop the bowel to wait for accumulation or to wait until you get to the washroom, so you just pass it out. Now, you can take several days without passing the stool, and this is due to 1, constipation, and 2, obstruction. If the tumor is big enough, it can be able to obstruct that, so your stool is usually take a little bit longer before it gets to the other side. So you start taking a really long time before you pass that stool, despite you taking a heavy meal. Now you might start getting, now this is when it comes to now a little bit more intense. This is you start getting blood in stool, and blood can be in 2 forms. We have the dark one, which means that now this blood came from the right side of the upper side, and also blood can indicate something in the upper region of the digestive system, even in the intestines, in your stomach, in the duodenum. So this blood will be a little bit different from the one that you are going to get closer to the anus, because this one will be dark, or sometimes can even be black. This is because now the enzymes and oxidation and everything will have worked on that blood, turning it into a dark substance. So you're going to find it that way. You cannot even miss, because if the blood was not that much, it might end up hiding in stool, so it's very hard to detect this. And like you're going to see, there's a test that can be able to detect this hidden blood. And we have another type of blood which is bright. Now, so bright red. So this one is in case you have an issue closer to the rectum. That means that now either you have a tumor or a trauma closer. So the blood did not take enough time for digestion, for oxidation. So that's why it's bright red. Now, why are you getting blood? It's because you have a tumor, and because stool is forcing its way through, it might end up starting to injure some of maybe the polyps or even that tumor, and this is where now you start getting that blood leaking into the lumen of the colon. But you have to note that blood can also indicate other things like ulcers and also a trauma in your digestive system. So this does not actually tell you that you have cancer, but it's a good indication. So if you corroborate this with other tests, you can arrive at knowing exactly whether you have this cancer. And kindly, if you're getting blood in stool, the first thing you should do is to rush to the nearest hospital so that they can get to know exactly what's causing that. Now, another sign is anemia. Now, this one can be detected by, for example, you get your blood out, or maybe you're in a hospital, maybe they draw your blood out, or maybe you're bleeding somewhere, and the blood is so pale. So you're not supposed to have pale blood coming from your veins. You're supposed to be dark red. But in case you have that, you might be having anemia. And this can come with other signs like being tired, being so sluggish, and shortness of breath, and this does not improve even if you rest. So this is an indication that you're losing blood, and like we said that you can get blood in stool. Maybe that blood is leaking into your intestines, and this is what you are now getting in that either hidden blood or the blood that you're going to see in stool. And a continued loss of this blood will create anemia in your body. So it can be one of the reasons. Like in so many other types of cancers, you might get unexplained weight loss. And this is because now the cancerous cells, they are over dividing because they require a lot of resources. So your body will have to burn more calories to provide the energy and whatever is required for the overgrowing cell. So you're going to have an unexplained weight loss. In most cases, you're going to find gas and cramps. Now, they are going to happen because now it's already obstructed. Now, this obstruction is building pressure behind it. And in case you have gas behind that point, you will feel a very, very sharp pain. And sometimes the cramps, they will come with that because now you are forcing it. Okay, the stool, the muscles usually force everything forward toward the exit. So because there is an obstruction already, so it's going to exert pressure there. So that's where the pain will start coming from. Now, when it comes to the later stages, this is now stage 4. You'll start getting metastasis. This is the movement of the cancer cells from one area to the other. And this is general for most of the cancers because now they're going to do almost the same thing. Because it affects other organs, you might find that you are having issues with the liver because now there was a hematogenous spread through the hepatic portal vein, and this will bring the issues with the liver. Also, the movement or the spread of the cells to the lungs will bring breathing issues and so many of those. When it comes to diagnosis, this is when we want to know exactly whether it's this cancer or how do we confirm whether you have this cancer. Now, this one will have to be corroborative because most of the tests are not specifically specific for the colon cancer. So it has to be corroborative. The first one is physical observation. This is looking for the mass in your stomach, the hard mass. This mostly can be either a tumor or if you have obstruction, the bowel will just accumulate behind that tumor. We can be able to feel that in the abdomen. So your doctor will palpate your abdomen to feel for the masses. So in case there is any, and you have something like there is a cancer marker we call CEA. This is a cancer marker we call carcinoembryonic antigen. This one will detect presence of the cancers that usually affect the intestine. So in case there is any, or if that test was positive and there's something like a biopsy, so a biopsy is whereby now using the tools we call endoscopies, we can insert that all the way into where the tumor is. Then we pluck a tissue from that tumor, and this tumor is taken to the laboratory where now histology is done. Now from that, we can be able to see the cells and tell whether there is a cancer or maybe they are prone to becoming cancerous in the future. So this is now a more conclusive way of knowing whether you have that cancer or not. Now treatment, like we said, it's very important for you to know this when it's still early. In case you so happen to have any of the symptoms that we mentioned above, it's very important for you to go see a doctor early enough, because you'd rather go and find that there was nothing wrong with you, it was just maybe a trauma that just resolved, other than just coming later on to discover that you had cancer that you could have already taken care of early enough. So it's very important, in case you find any of the symptoms that we have mentioned, just rush to the hospital. Now, treatments include removal of the precancerous polyps. In case you have a polyp, it's very important for that to be removed in case maybe you're in a place where that can be able to be accessed. If it can be accessed and removed, the better. Now we have early screening, like we said. It's very important to know when this is early or when it's known. But we have some treatments when it comes to cancer now, one of which is radiation. We have chemotherapy, which I don't think I actually need to explain more about this, but I think we are going to make a video about radiation, how it works, chemotherapy, how it works. So some of the prevention, one of which I've mentioned, is early screening. And another thing is sharing this video. This video has a lot of information. So if you share this to someone who will go and try to correlate the signs and the symptoms they have, they might end up going to a hospital. You might have saved a life, and also we might have reduced a cancer incidence by one or several. I would be very happy if you just subscribe, and also make sure you share this to the people around you, the people you care about. Now, we have early screening for especially people who are above 45 years. And also, if there is a family history of cancers, it's very important for you to get screened as early as possible and as regularly as possible. Reduce sugar intake. Like I said, it doesn't actually cause cancer. Sugar is bad because it causes so many other if you take excess of the sugar, it causes so many other conditions in the body, including diabetes and high blood pressure and all those. And it makes the cancer to be worse, because now you're giving it enough food for the over-dividing cells. So you will reduce the intake of sugar. Don't take sugar in excess. Just take a tiny amount that's necessary, and if you can just do without it, the better. If you can replace this with complex carbohydrates, the better. Now we have reduce or possibly stopping the drugs. If you cannot be able to stop, reduce them completely, because now by doing this, you'll have improved the quality of life. Now that's all for today's video. So I hope you gained value, and if you did, just give us a thumbs up, and let's meet in the next video.